I'm happy to see you all today. So we're going to start our panel discussion. At the meeting of the National Council for Science and Technology under the President of the Republic, Kassym-Jomart Tokayev acknowledged the idea of funding a hub for clinical studies in Kazakhstan. He also emphasized on the importance of prioritizing the development of the science and research infrastructure. So today, we are happy to offer a platform to discuss clinical research, learn from our Kazakhstani fellows, clinician-scientists from Switzerland and Germany. We are honored to welcome our speakers, Galymzhan Issabekov, Arailym Aronova, and Salikhanov. I would like to remind everyone that our talks is going to be 10 to 15 minutes each, followed by 10 to 15 minutes Q&A session. I would like to ask our dear audience to enjoy the talks and write any questions or opinions in the chat, and we can address them during the Q&A session. If you want to ask a question personally, please raise your hand during the Q&A session, and we will offer you a speech. Now, please join me in welcoming our first speaker, Galymzhan Issabekov. Galymzhan Issabekov is the founder of Kazakhstan European Science Association. He is also a doctoral researcher at the Department of Neurology, Charité, Berlin. Holding a medical degree from Peking University, Beijing, China, he completed specialized residency in neurosurgery at the Beijing Institute of Functional Neurosurgery. Following this, he undertook clinical research fellowship in Florida, USA, and Tokyo, Japan. These experiences provided him with the opportunity to work alongside leading experts in the field of space medicine and clinical neuroscience. Currently, he's conducting research on deep brain stimulations for movement disorders. Please, Galymzhan, you can start yourself.
Aliya, thank you very much for your introduction. Can you see my screen? So before I start my talk, I want to briefly introduce our association. So Kazakh European Science Association, it's formed for that unite European Union countries, and we're trying to be a melting pot of academia, industry expertise to try to form a perfect catalysis of discovery and innovation. So our association, team of our association mainly consists of 3 persons. Me as a founder, Aya Yespolatova, it's event organizer, meeting facilitator, and Professor Serik Mirmanov, project consultant. So 2 of our members currently in Japan. I'm here in Germany. So this is our team. So starting from 2014 till 2024, over 10 years, we try to organize different types of meetings. So you can see here, it's our previous guest speakers from different universities. Taskan from Peking University, Chingiz from New Zealand, Alibek from Tsinghua University. So over the 10 years, I've been in several countries, including China, US, Japan, and finally in Germany. So we try to find these interesting individuals and invite as a guest speaker. So we have organized more than 20 online and offline meetings featuring Kazakh researchers working abroad in China, Japan, US, Hong Kong, and New Zealand. Other than that, we also have close contact with already established scientists that working around the globe, all of them Kazakh researchers. And for more details, you can visit our website, most of them from Europe. We also have from United States. So currently we have contact with all of them and trying to invite every month one to share the expertise, academical culture or different countries. Yeah, thank you. And briefly about the mission and about our association, as I mentioned before, Kazakh European Science Association tried to bring together scientists, educators, graduate students, and other scientific technical professions from universities, industries. And we currently working who is currently working and studying within European Union countries, and not only. And we, as I mentioned, trying to be platform, include people from academia and industry to have really good platforms that will benefit to our members. Our mission is maintain, strengthen, and develop common intellectual and cultural space of Kazakh sciences community across Europe, and try to provide expertise to professional community or public on scientific and education discoveries and innovations. This also include scientists in Kazakhstan. We're also collaborating with them currently. So our strategy is to exchange knowledge and international practice in science and education, to initiate and coordinate some collaborative projects in science and education, what we currently are doing. So as Aya mentioned previously, our project consultant, Professor Meirmanov from Japan, currently attended presidential meeting, chaired Qasım-Jomart Tokayev in National Council for Science and Technology in Agorda Place. So they, as among the other international scientists, he was invited as from Japan to participate in this meeting, where the president highlighted the urgent need to enhance national scientific capabilities. And finally, president emphasized the strengthening specialist training in key sectors like healthcare and health industry and artificial intelligence, and also try to create some platforms to contact these scientists that working abroad. So our association trying to match these interests of our country and trying to create this platform to connect other scientists that working abroad. So for this year, we organized 3 types of meetings. The first one is a monthly seminar series where we invite interesting individuals that can share their insights, their experience, and also have Q&A session with other young scientists. Last time we invited Honest Yergaliyev, who did his PhD in Harvard School of Public Health, currently in Nazarbayev University. It was very helpful, very interesting session. Other than that, we're also organizing panel discussions where we're inviting people from different backgrounds. That was last time we invited postdocs from Asia Pacific countries like Japan, Hong Kong, China, and New Zealand to share the working condition, the academical culture. And other than that, we invite people from industry. Last time we invited Anara Nursaliyeva. She working in Roche, and it was pretty helpful for our audience to know other career perspective outside of academia. So our panel discussions, we organizing panel discussion on different topics. And last one, what we organized last week, it was urgent one. So we invited specialists from around the world. One of the leading keynote specialists was Friedrich Khatkov from Netherlands, where he visited Kazakhstan and gave professional insight on ongoing situation. We also invited other professionals from Kazakhstan, within Kazakhstan, like Asil Issabekova, Vadim Yapiv, Nurlan Ongdaz. And it was a really helpful session to try to do something from our side as a scientist. And if you're interested, you can also go to our official YouTube webpage and watch that session. In addition, on our website, we have interesting tools like worldwide map of Kazakh researchers, and where you can find this interactive map pinpointing the location of Kazakh researchers across the globe. And yeah, for this, you can visit our website to see the details. If you're traveling for conference, visiting other cities, you can easily find other researchers, contact with them, and maybe meet with them. So here's overall picture of our map, and this one is not have been updated for a long time, but you can also visit our website. And here all scientists that you can find also on our website and see the details by clicking the read bio. So thank you very much everyone for listening about, and here's the end of my introduction about Kazakh European Science Association. And last one, so regarding today's meeting, so we for today, we have invited medical professionals from Switzerland and Germany, who is doing clinical scientist career paths, including challenges, rewards, and transition to other fields. So this was very interesting to our audience. And we tried to gather talented individuals from Switzerland and Germany and try to take 100-minute sessions to get very helpful information for our audience and try to explore what's career opportunity we have here in Germany and Switzerland. Is there any opportunity to do transition to other field? So our session will consist of 15 minutes talk followed by 20 minutes Q&A session. So if you have any question, please type your question on chat box and we can address them. So this overall introduction about our association, I will change my slide to presentation slide. Can you see my screen? Guys, can you see my screen? Yeah, good. So thank you very much, everyone. Again, so let me start. My name is Issabekov, working in the Department of Neurology as a clinician, as a doctoral student. So today I want to share my insights that I hope will be beneficial for everyone. So this 10 years of traveling several countries and doing research work. So briefly about me, as I mentioned, Aliya Issabekov, doing doctoral research here in Charité University and Department of Neurology, currently advancing doctoral research on deep brain stimulation and microelectrode recording to improve Parkinson's disease treatment. So here you can see this is overall picture. What's the deep brain stimulation? So deep brain stimulation is neurosurgical procedure that implant electrode and make electrical stimulation for movement disorders associated with Parkinson's disease, essential tremor, dystonia, and other neurological conditions. So I'm conducting research on DBS and microelectrode recording to improve Parkinson's disease treatment. Over the last 10 years, I've been fortunate to visit several countries. So I did as I mentioned, I did my medical degree in Peking University. After that, I did my residency program in Beijing Institute of Functional Neurosurgery. Following, did 2 research fellowship in University of Florida and Tokyo Women's Medical University in Japan. And now I'm here in Germany in Charité Hospital. So I want to stop on my experience that I gained in China. So so for 10 years, I stayed in China. After medical degree program, I get the residency program of neurosurgery and Beijing Institute of Functional Neurosurgery. Here you can see our hospital. It's one of the biggest hospital in neurological disease. So it's pretty unique what you can see in China, like 1 million patients every day within Beijing, and a lot of different hospitals concentrated in Beijing, and one of them is our hospital, which is mainly looking for neurological disease, including neurology and neurosurgery. And here's our department. I've been in Department of Functional Neurosurgery. We mainly treat disease like movement disorders, epilepsy, spinal cord stimulation, and all of the disease related to functional neurosurgery. So here you can see this is our department before Chinese New Year. So at that time, my research interests mainly spanned to several categories. One of them was deep brain stimulation, which you can see here on the right side. On the center, we have spinal cord stimulation for thumb pain or phantom pain disease. Other than that, we also did surgery for epilepsy, like resistant epilepsy patient. So here you can see stereotactic electroencephalography. So in order to find epilepsy location, for some patient you need to do electrode insertment within the deep structure of the brain. And currently, with the old technology what we have, we can do it very safely. So you can see there's electrode implantation after the surgery. And other than that, I also, our institution have this focused ultrasound technology where you don't need to do incision, neurosurgical incision, but by using focused ultrasound, you can ablate this lesion territory, which is responsible for some symptoms of Parkinson's disease. And for my so in China, when you're doing your residency program, you're also responsible to do your research. So I did my master dissertation on hemispherectomy. So hemispherectomy is a big surgery that you remove half of the brain. So as I mentioned before, in China, this kind of hospitals is very big, and you have huge amount of patients which come every day. And this surgery, it's in a developed country, in one center, you can have maybe 2 within the 2 years. But in China, because of this capacity of population, we have huge amounts of data. So one of the part of my master dissertation, I analyzed all this data that have been stored in our hospital and made surgery for these patients. To be directly just removing half of the brain and looking for follow-up situation of these patients. So personal insights, staying in China for more than 10 years, including medical school and residency program. I think for medical students, it's a great opportunity because what I saw there, a lot of students from developing countries coming to China, and they gaining the degree, medical degree, and also preparing for a medical license examination. So China is a good stop where you do your own stuff, and especially preparing for other license examination outside of China. And yeah, and other than that, I think for clinician-scientists is also a great place because currently China is improving on doing these clinical research studies, and number of patients that you have in China, I think it's something interesting that you cannot see in other countries. I remember during my residency program, me and my supervisor, during outpatient clinic, we see about 40 to 50 patients in one afternoon. To compare, in developed country, you only can have appointment for 10 or 15 patients. So it's huge difference, and they kind of trying to manage all this situation. And I think this is pretty unique things. If you already established as a doctor, I highly recommend to make short trip fellowship to China, visits at hospitals, look how they're working, what they can do more effectively. And yeah, overly personal insights, I highly recommend to also visit China to medical professionals. So during that time, during my residency time, I found that it's important not to only be local and stay in China, but go outside. So I started to prepare for United States medical license examination over my residency time. And I also attended several conferences. We published 3 papers, one first authored and other collaborative 5 papers. And during the visiting different conferences, I visited one of the interesting conferences. It was World Neurosurgical Journal Editor-in-Chief meetings in Shanghai, where leading neurosurgeons, chief editor-in-chiefs come to China, so you can have opportunity to talk with them and ask questions that you wondering about. And so I asked them as my profile that I have in China, have a medical degree, have also residency program, what they can recommend to me to improve my opportunities to get to residency program in the United States, because neurosurgery program is very competitive. So they said, like, Aliya, you need something special that can make you different from other candidates. And so this is important, you need to find something. So this was good insight. So I tried to think about what I can do in order to improve my CV and portfolio. So I started to look different programs so one of the programs, this Takomi Taira from Japan, very famous neurosurgeon within Japan and globally, he visited our hospital. So I had opportunity to talk with him and ask if there's any opportunity to visit your lab, visit your department, because the study that he's been doing, it's very interesting to me, especially focused ultrasound without doing any section. You can use ultrasound power to ablate these pathological locations in order to treat these patients. And he replied. So he said, Aliya, you can apply for Takeda Science Foundation, and this program can support your stay in Japan for 1 year. So I also want to emphasize, if you guys want to visit Japan as a medical doctor for 1 year doing research fellowship, this program is amazing. Takeda Science Foundation, you're submitting your documents with a supervisor, and after revision, if they agree, you can come to Japan and stay within 1 year, and they paying for your flight ticket, paying for your stay in Japan. And yeah, I think I highly recommend this program. So I've been accepted by Takeda Science Foundation, but unfortunately we had pandemic at the time, so I stayed in Kazakhstan. And at that time also so I tried to constantly think about what can make my CV or portfolio very competitive. So I found really interesting topic related to brain, like space flight induced brain neuroplasticity. One talk was, at the time, Zoom was something amazing, that we have remotely meeting with different amazing scientists. So I attended a talk of Floris Weitz, professor from Belgium, which studying cosmonauts MRI scans, and tried to look, is there any effects of long duration space flight on human equilibrium or brain and brain. So, and that was interesting to me, just to listen what they're doing. Is there what's important work they're trying to contribute. So I said, oh, that's interesting. Let's explore more. Maybe I'm also looking forward to learn new things, because of pandemic and everywhere closed. I cannot go anywhere. So I said, okay. And later I applied for University of Florida for doctoral program, PhD program. Actually, before that, I also applied in China for doctoral program, but because of pandemic, I stayed in Kazakhstan and my program in China. So I thought it's very hard to continue this way doing my PhD program. So I decided, okay, I'm not continuing doing my PhD in China in my hospital, but looking at other opportunities. So I found University of Florida, one of the scientists, also colleague of Floris Weitz, who agreed to accept me as a PhD student to do research in a space flight induced microplasticity. So here's a brief work, what I did during my 1 year. So here you can see astronaut. So during the space flight, a lot of astronauts and cosmonauts have a lot of stressors. What do we have? And this stress is affecting the human brain, astronaut's brain. And what we have found that during his long-term space mission, there's upward shift of astronaut's brain. So you can see comparison after and before 6 months flying to International Space Station. So you have upward shift of the brain. You have ventricular expansion. So there's a pre-flight, post-flight, and you can see gray matter volume changes in fluid cerebrospinal fluid redistribution. Other than that, one of the current actual problem is ocular changes. So you can see in astronaut after the flight, there's optic disc edema, choroidal folding, globe flattering, and hydropic refractive error shifts. It's pretty much similar, kind of similar, but not 100% glaucoma, what we're experiencing here. So it was, so our study is proposed, is it changes in eye is related to brain changes or vice versa? So during the 1 year, my supervisor had MRI scans of astronauts, and we tried to compare them before flight and after flight. So you can see here, so this is actually for what I did for 1 year. But after, and during that time, I really developed passion for human space flight and space medicine, aerospace medicine. and visiting Houston Space Center, Florida Kennedy Space Center, and trying to really dive on this field. And I've found it pretty fascinating. Here's some pictures of visiting. Here on the right side, you can see there's International Space Station, really mock-up models that are located in Houston. And yeah, if you want to read in details, you can. I can share the screens where I shared all this information. And also here you can see different. So my passion was really developing into this field, and I want to share all this information with other people. And I also attended Bilka and Strelka podcast, where I shared all this information, what I learned over this 1 year very extensive study, and also trying to share with younger generation that we have this space medicine field. Well, we with Ayan Nurkesh from Nazarbayev University also published on OILA journal. So here you can see what happening to human body in a microgravity environment, actually to astronauts currently. So pretty interesting. If you're interested, I can send it to you so you can read it on English, or and also made social media platform to share all these knowledges, what happening to human brain, human body, especially within this space flight. So personal insights. And after staying for 1 year, I realized that I'm getting too far from this clinical practice. And some doctors, clinician scientists said to me, which working within the space medicine field, Aliya, you need to stick to your field, like neurology or neurosurgery, and try to contribute to space medicine field. And after that, I decided it was really hard to me, but I decided to reject my PhD studies and find something that's really close to clinical medicine. So for me, personal insights, staying 1 year at the University of Florida and in the US, it's really, I think, what I learned there, it's how to be a professional researcher. I think it's this saying, it's very bold, but they really teach you how to represent yourself, how to conduct systematical study, and how to and I think just learn another perspective in American way to do clinical research, to do studies, and how to get funding. I think it's total different system within the US if you compare to other countries. So we can discuss more later. So, and following that, when pandemic is ended, Japan Takeda Science Foundation contacted with me, said, Galymzhan, you can come now, and we borders are open. So I agreed, and from Miami, we with my family flew to Tokyo. And during my stay in Japan, it was amazing year. Mainly did 2 types of studies. First one related to epilepsy, a second one related to space medicine, and meet amazing people. It's here you can see on the right up corner. It's Dr. Shimada. He's a doctor, a physician of Japanese cosmonaut and astronauts, let's say. And here's below, it's a Japanese astronaut. So, and I also he said, Dr. Shimada said to me, Galymzhan, it's interesting to know like what Russian and Kazakh cosmonauts are doing after this cosmonaut career. Can you tell us, explore this data and tell us something interesting? I said, yeah, I can do that. So I presented also this study, a brief history of Kazakhstani human flights and analysis of missions and cosmonaut selection. What exactly Kazakhstani cosmonaut did on space mission and how the selection has been performed. And more related to clinical studies, this is my project. At that time, what I conducted in Japan, we published this paper. So we mainly try to differentiate, use this MEG system, magnetoencephalography system, to differentiate generalized epilepsy from focal epilepsy, because it's very important to in a diagnosis for this patient and perform other treatment options. So I will not stop on this here more. And so personal insights staying in Japan, I think it's, for me personally, 1 year is enough. And amazing country, amazing people, but I think for me personally, it will be great just to stay for 1 year because of it's very hard in some cultural aspects because Japanese people are different and working culture is also different. If you're going to international hospital or international colleagues, let's say, it's easy to work with them. But if my supervisor, I was pretty fortunate. My supervisor graduated from UCL, stayed in UCL for several years of postdoc, and he's pretty much international. But other scientists, I think it's pretty local and it's different that we experienced before. So I highly recommend this country, and also I learned that some things make it better. People really good on. Often you think it does not make matter, does not make sense of, for example, one thing, but you can improve it more, and it can be very efficient in some matter. I need to give some examples. We can discuss it later, but yeah. So we with my family visited Japanese space flight center. It's in the southern part, Tanegashima, where they're launching the rockets. Yeah, it was pretty amazing. So currently, I'm in the Department of Neurology at Charity Hospital, and what I'm doing here, as I mentioned before, here this deep brain stimulation tactic is just helping to control symptoms of Parkinson's disease. So here you can see a video of patient. This one on left side is without deep brain stimulation, when it's turned off, and this one on the right when deep brain stimulation is turned on, when stimulation is conducting continuously on a deep structures of the brain. And the difference is very obvious. You can see when stimulation is turned off and when stimulation is turned on, patient life of quality increasing tremendously. And but problem is that when stimulation is turned off, patient immediately have the symptoms of Parkinson's disease and non-motor symptoms. So we trying this an upside. This is a scene from our operation room where we, as a neurophysiologist during the surgery, record these neuronal signal patterns and try to guide a neurosurgeon to say, okay, we are exactly in a target of subthalamic nucleus. You can implant this electrode. So very shortly about my project. So my project is using microelectrode recording system. This is a pretty unique system where you can detect during the surgery when patients is awake, detect this neuronal firing pattern. And according to this pattern, you can kind of trying to navigate in order to get to right structure, subthalamic nucleus, and help neurosurgeon to precisely locate the electrode within this structure. And post-operatively, patient get awake, system is turned on, and patient really have good improvement of this Parkinson's disease symptoms. On the right side, you can see the scene in an operative room where patient is trying to paint something, and we compare before stimulation, after stimulation, how's improvement is going on. Yeah. So, and lastly, I've been asked to talk about like opportunities of being a doctor in Germany. And I found a really good paper article in internet. You can read it later. In Germany, it's about like $60,000 doctors without German citizenship currently working within country. So it's 12% of medical workforce. And you can see here over the 20 years, the number of medical doctors is really increasing because this trend, not only in the medical field, but within all countries, several sectors really need the professional workers from other countries. And here you can see foreign doctors currently working in Germany, this distribution of countries, how many doctors. So you can see this almost 60,000 doctors as a foreign doctors. So I think overall, in our audience, we have established doctors that working here in Germany. Its way is very straightforward. If you look for internet, how you can get this approbation of your license, of your previous license in your country, you can easily find it. I will not take your time on talking about this. Maybe later on discussion side we can talk about this. And yeah, So thank you very much. This is my social account, Spaceman Aliym. If you're interested, I'm not very active on that, just trying to share my personal life experience. And I also have my website. If you're interested to contact with me, I'm looking forward. So thank you very much for your attention. Yes, this is my talk. Sorry for taking too long. I guess I already yeah.
Don't worry about it, Galymzhan. It's an awesome talk. Thank you so much for sharing your rich experience, especially the insights you gained from clinical research abroad. We do have questions, but we're going to save them for the Q&A session. And I am delighted to welcome our next speaker, Salikhanov. Islam earned his medical degree in general surgery from Astana Medical University and furthered his education with a master's degree in public health from Nazarbayev University. Last year, he was awarded his PhD from the University of Basel. Presently, he serves as a clinical researcher in cardiac surgery at the University Hospital Basel, contributing to advancement in the field. Please, we welcome today, Islam.
Hello, everyone. First of all, can you tell me, please, if you see my slide?
Yes, we can see it.
Okay. Because now I turned on my slide and I don't see you. So, yeah, we will communicate verbally. So first of all, thank you very much, dear colleagues, for having me here. It's an honor for me to contribute to this event. Thank you. My name is Islam. I'm originally from Pavlodar, but I did my medical studies at the Medical University Astana, 7 years, including 2 years of general surgery. But then after my graduation, 2016, I went directly to the Nazarbayev University. I was in the very first cohort who did master's degree in public health there based on the School of Medicine at the Nazarbayev University. 2 years where I got my first taste of science and research that I fell in love with. And my third educational step is PhD in public health here in Basel at the University of Basel in Switzerland. 3.5 years of PhD in public health that we will discuss in more details a bit later. So in between master's degree and PhD, I worked 2 years at the National Research Cardiac Surgery Center in Astana, but I was responsible mostly for education and research. This is, I think, one of my best working experiences I had there at the cardiac center. So now I would really like to discuss with you guys funding, how you obtain the funding for your studies, for your research in Europe. Because definitely, if you are here, I'm pretty sure you're interested in having an education, receiving a PhD diploma here in the European Union. So first of all, you have probably heard about the funding called Horizon 2020. Galymzhan, can you give me feedback? Can you hear me and see me clearly?
Yeah, Islam,
Yeah. Okay.
I don't know why, but your presentation is a little bit blur. Yeah, blur, but I don't know, it's from my side or other. Arailym, you also?
Can you give
it's
me
saying to me as well. I think it's because of internet connection, maybe.
Could you please check the internet connection if possible?
Mine?
Yeah, your internet connection, I think, is a little bit poor, and that's why we cannot see you and your presentation.
Oh, you can't see my presentation.
Well, we can see it, but it's blur.
Okay.
Like,
I'm using basically Wi-Fi.
Oh.
I don't know what to do, guys. You don't see the slides clearly.
yes.
No, I think now is good. Now is good. Now is good. Yeah. Good.
Yeah.
You can continue. Go ahead.
The most important thing I will be explaining, and if people will have questions, I will be happy to respond after.
now is much better. Yeah.
Okay. I just basically returned my presentation. So now I would really like to discuss with you in details how I obtained the funding for my PhD, because your PhD is money. You have probably heard about the funding called funding organization, NGO called Horizon 2020. This is probably the largest funding program worldwide, definitely in the European Union. Horizon 2020 has $1 billion dedicated for science in Europe. And it supports, including PhDs and postdocs in the whole of European Union, and not only European Union, but the whole European continent. So Horizon 2020 provides funding to smaller NGOs, smaller funding organizations. In my case, it was Maria Skłodowska-Curie Foundation. It belongs to the European Commission, and this foundation focuses on supporting PhDs and postdocs only, and distributes money throughout the whole of European Union. Galymzhan, can you see the slide?
Yes.
Okay, good. It's blurred because there is only one picture here, one image.
Yeah, no, it's good. You can continue.
Okay.
Go ahead.
Okay. So the Maria Skłodowska-Curie Foundation distributes money all over the Europe, Germany, France, and even Switzerland. While Switzerland is not part of the European Union, it has some affiliations and agreements with Europe. And therefore, this foundation gives money to Switzerland, but not to the government of Switzerland, not to the ministry, but to other NGOs here in Switzerland. In my case, it was Swiss School of Public Health, SSPH+. Swiss School of Public Health, it's not an academic institution. It's just an NGO, independent, which has some agreements and affiliations with Swiss universities. So the SSPH received the money from the European Commission and decided to announce a call. A call means competition for 50 PhD scholarships in public health, only in public health. 40 of these PhD scholarships were dedicated to European citizens, so not us, but only 10 were dedicated to non-European third country nationals, including us. Therefore, among the rest 10 were me, the guy from Kyrgyzstan, Ukraine, Middle East, and Africa, mostly. But 40, the majority are Europeans. So I was awarded with the funding for my PhD, and this money traveled to the University of Basel because I have chosen this university. It's not them who decides. It's me. I found a professor at the University of Basel. So the overall picture, how the money traveled, looks like that. Horizon gives money to Maria Skłodowska-Curie Foundation, SSPH+, and the University of Basel. And finally, me, standing happily there with my PhD diploma, which I received last August. I'm giving this information, colleagues, just for your interest. You don't need to know all these details. I'm giving it to you because I want you to understand that there are millions of opportunities to get the funding. So in Kazakhstan, there is Bolashak, right? And majority of people know only Bolashak. But in Europe, there are hundreds of funding organizations which would be happy to give you money in case if you have a interesting research idea that we will discuss in a moment. So during my PhD, I published 5 research papers, 4 of which were dedicated to Kazakhstan, and namely palliative care for cancer patients in Kazakhstan, not in Switzerland or Europe, Kazakhstan. And that's how I won the money. That's how I was awarded with the PhD funding from the SSPH+. There was a competition which was based on your research proposal. They say, okay, you want money? Show us what research idea do you have? Give short description, 10 pages Word file, introduction, planned methodology, and foreseen results, implications of your research. Explain why you do it, why it is actual for your country. Because they funded the research which were actual in your country, not in Switzerland, not in Europe, but in your country. So Kazakhstan, Kyrgyzstan, Nigeria, etc. So I gave them the research proposal I developed, and that's how I won the money. And I published this research during my PhD, because the main outcome of your PhD are publications. This is the main requirement. It's all about the publications. And all of the publications were with me as the first author. And as I mentioned, I defended my PhD. Galymzhan, do you see the slides? I'm a bit concerned.
No, yes, absolutely. Great.
Yeah, good. Thank you for the feedback. So in August, I defended my PhD last August. And since September, so 7-8 months, I'm working in clinical research at the Department of Cardiac Surgery at the University Hospital Basel. So I did my PhD at the University of Basel, and this is the University Hospital Basel, Department of Cardiac Surgery. So we are doing research on patients after coronary bypass surgery, the other with the patients after aortic dissection. So I really love clinical research because it stands at the crossroad. It's the golden middle between medicine and research. So I'm in between because I have both MD background and PhD background. So it's nice connection for me. I got a question from Galymzhan per email to give you some pieces of advice. And many people, I receive many questions on Instagram, namely about how do you register your MD diploma in Switzerland. Your MD diploma from Kazakhstan. You remember, I have MD from Astana. It's completely independent process from my PhD. Forget about my PhD now. It's completely independent process. If you have your MD diploma and you have minimum B2 level in German or French, these are Swiss languages, you can register your diploma in MEBECO. MEBECO, it's Medizinalberufskommission, Commission of Medical Professions at the Department of Healthcare here in Bern, in Switzerland. Here you see the list of documents which you should provide, the copies, legal copies. You just go to lawyer, notarius, and you make legal copies of these documents. And paper copies you send to Bern. You pay about €1,000. Yes, it's Switzerland, it's expensive. And your diploma can be registered here. What does it mean? It means that you can start searching for a job in Switzerland. Yes, the process is that simple. I was also surprised. You just register your diploma and you can have a direct access to the labor market. You can searching for a job. You start the job, you receive a salary, Swiss doctoral medical salary, basically. And after several years, you do some additional examinations that we are not discussing here. So this is how you register a diploma. In more details, we will discuss later if you will. But the main challenge here is your German, in my case, German level, minimum B2, better C1. That's it. All the other documents you have. Then, some challenges dear colleagues, from my experiences and some pieces of advice that I would like to give you. I just imagine that, let's say all of you want to work here, right? Or do your studies here. So some challenges. You are far from home, I'm far from my family, and I meet my friends and family members, relatives once a year. This is probably the largest challenge. You understand what I'm saying. Switzerland is expensive. It relates mostly to Switzerland. Switzerland is extremely expensive, so you better have some savings, at least for the time you are, let's say, searching for a job, if you come here, or you search for studies, but you can do it back in Kazakhstan. I searched for PhD and won the scholarship when I was in Kazakhstan. I've never been in Switzerland before. I came to Switzerland and started my PhD in March 2020, the time when pandemics hit Kazakhstan. You remember this quarantine, and it hit Switzerland. So it really worsened my experiences as I was locked in a room for almost a year. Conservative people, it relates to Europe, less to US, but mostly to Switzerland. Don't expect to be welcomed, okay, everywhere. So this is another challenge that you might meet. Strict migration laws, it relates to all European countries and especially to Switzerland, which has extremely, probably the most strict migration laws worldwide, probably can compete just with Japan, especially because we are not from European Union. So our rights, or not rights, but access to labor market is very, very restricted. Some pieces of advice for you, dear colleagues: know the game you play. Again, migration laws, know the migration laws by heart of the country that you are going to. Grant requirements and university requirements are two different things. If you get the money from the different organizations that I mentioned, believe me, they have their own requirements. Why they give you money, what they give you money for, and how you report. You finish your PhD, you should provide the report. In Kazakhstan, after Bolashak, you must come and work in Kazakhstan. Here, it's not like that. No, you don't have such an obligations, but definitely there are some requirements. So be aware. University has its own requirements for your graduation. Also know it. Then, as a working or as migrant student, you would have definitely hundreds of questions about the migration, about your studies, labor market, etc., etc. So don't hesitate to ask. Ask your neighbors, ask alumni, ask, I don't know, people on the street. There are definitely departments. So in Basel, there is a department. It's called international students, something like that. It gives you information as to international student about any matter. So don't hesitate to ask. Ask thousands of questions. Know about the employment rules, because studying in Switzerland and working in Switzerland are two completely different things, completely different rules. And finally, think strategically about your career, about your future, not tactically, not short term. Think as a military strategist, how, where, and when you should make a step forward or step back, step left, or step right. Think strategically how you would position yourself on the labor market in the future. It's very important if you plan to work here in Western countries. Fails happen, guys. We can't avoid fails. Galymzhan, can you see the slide? Give me feedback, please.
Yes.
Okay,
I can see
good. I'm finishing. So fails happen, but nobody cares. So in my experiences, I would share with you some fails that I had. First of all, I was in the waiting list for my master's degree at the Nazarbayev University. I wasn't accepted there. Some guy has withdrawn his application, and that's why I was accepted. So it was kind of mix of fail and luck at the same time. But believe me, if it wasn't for my master's degree at the Nazarbayev University, I wouldn't be here. Definitely. So it was very important, life-changing experience for me there. Secondly, from my presentation, you might think, oh, you just apply and you get the money. No, it's not like that. I got rejected tens of times for my PhD. I got rejected 2 times, I remember, at the US universities, tens of times here in Europe, in Switzerland, and even the organization that gave me money, SSPH, they rejected me during the first calls previously, 2019. And my PhD defense was postponed because I made very silly mistake, guys. I'm not going into very details, but I did very silly mistake and I almost lost my job here. So my PhD was scheduled for June 2023, but finally rescheduled to August 2023. But I already had my working contract at the Department of Cardiac Surgery signed for July. So I needed to postpone it. Luckily, they, I would say, had mercy on me and postponed my working contract too. So that was epic fail in my experience. So be prepared, fails happen. So thank you very much for your attention. I would be happy to respond to your questions today. And please join me on my socials. I have a quite active Instagram page, Dr. Salikhanov. Would happy to see you there. Thank you very much.
Thank you so much. It was a really interesting talk. Not just general advices, but very specific advices from how to apply for grants and how to set and improve your life abroad. And I am happy now to move on to the last talk, and I'm thrilled to welcome Arailym Aronova. Arailym Aronova is a doctoral researcher at the Institute for Stroke and Dementia Research at the Hospital of Munich. Her research is in cardiovascular medicine, and she explores the molecular mechanisms of atherosclerosis. She obtained her medical degree from Arailym Medical University and experience in emergency medicine in Almaty, Kazakhstan. Holding a master's in cardiovascular medicine from the University of Bristol, UK, she specialized in the WNT signaling pathways role in vascular inflammation. Beyond science, Arailym enjoys landscape photography, hiking, exploring art galleries, playing the piano and dombra. Thank you so much for joining us today, and I forward you the mic.
Thank you very much for introducing me. Let me first screen. Do you see it? No.
Not yet. We don't.
Yeah, we can see a white screen. Yeah, it's now we can see it.
All right. Let me. Do you see it? I don't see it here at all.
Yeah,
we see it.
Wait. All right. Yes. All right. First of all, thank you very much for organizing such a great project, such a great event. I am really enjoying this discussion so far. So, all right, about myself. My name is Arailym Aronova. I'm a fourth year PhD candidate here at Ludwig Maximilian University of Munich, LMU, here in Germany. So let me go back to the starting point and let me go through with you through my career path. So I studied at Astana Kazakh National Medical University in Almaty. where I obtained my MD degree in internal diseases, internal medicine. During my final year, I was already applying for several master programs in the UK universities, since it was my dream to study there. And here comes the fact I'm really proud of. So I've applied for 8 universities in the UK, and I got the offer from all of them. So obviously it's University of Bristol, but also I've got the offer from King's College, Imperial College London, University of Glasgow, Newcastle, York, Sheffield, and Sussex. So I went obviously with University of Bristol, as you can see, for a funding reason. I have applied to Bolshak Scholarship and I actually won it. So I went to England. This journey was really interesting. I really enjoyed this journey. So basically, during my master, I was studying as well, but also working in the lab for my thesis. So my dissertation was focused on Wnt signaling pathway in shear stress-induced atherosclerosis. So after graduation from master with distinction, I came back to Kazakhstan and I worked as emergency medicine doctor at basically so-called residential hospital or Sovminka in Almaty. Well, it was really intense, I would say, really stressful, but also very interesting journey, interesting experience. It was 24 hours on call and 48 hours off shifts. And you are basically responsible for emergency room, but also you are responsible for night calls at cardiology and cardiosurgery departments. It was also very intense because unfortunately it coincided with pandemic. And so basically I was also responsible for COVID positive patients. But I realized that during this clinical journey, I was actually missing the research part. That was missing. I have never planned before Bristol that I'm going to pursue science, but during my master, I realized that I was really in love with research, science, but also wet lab experiments. So I've decided to pursue my career with PhD. So instead of avoiding all those what if, like, you know, so I applied for several PhD programs, and basically in 2021 I started my PhD here. So what am I doing here? So basically I continued my topic during my master. So during my master I also studied atherosclerosis, different pathway but same topic. Here just to explain you how urgent the situation is, how the problem is very actual. This is the death rate from ischemic heart disease. And as you can see here, Kazakhstan has a very high rate for death rates from ischemic heart disease. So as you all know, atherosclerosis is a leading cause of mortality worldwide. I'm sorry, quick check. Do you see my screen?
Yeah.
All right. So as you all know, atherosclerosis is a leading cause of mortality worldwide, as it is underlying pathology of major cardiovascular diseases, including large vessel stroke, myocardial infarction, and PAD. Although it is lipid-driven disease, underlying inflammation orchestrates the progression and outcome of the disease, whether lesion would be stable or so-called vulnerable. So atherosclerosis is initiated by endothelial dysfunction. The development of the plaque can go in 2 directions. First, if there is still pro-inflammatory background, then monocyte infiltration and macrophage apoptosis continue, leading to the formation of vulnerable plaque with thin fibrous cap and large necrotic core, which can eventually rupture, leading to thrombus formation, arterial occlusion, and sudden cardiac death. But good news is regression of the plaque is possible. Regression of the atherosclerosis is possible by high level of cholesterol efflux, from macrophages to HDL, or large amount of pro-resolving macrophages, which clear dead cells through efferocytosis. So previous work of our lab here has been mainly focused on inflammasome activation and pyroptosis in ongoing chronic inflammation in existing plaque. But what about LDL retention from the arterial wall with scavenger receptors? So here comes my topic. What is the scavenger receptor? What do we know about them? So scavenger receptors are superfamily of proteins which are expressed on the surface. So far, we know over 12 classes of scavenger receptors. And so, for instance, here in endothelial cells, it has been reported that scavenger receptors actually binds to cholesterol and basically transport it through the endothelium and deliver it to the intima. In intima, macrophages basically engulf this cholesterol, oxidized LDL, through different scavenger receptors, including scavenger receptor A1, B1, CD36. These are very well-reported scavenger receptors. Unfortunately, I cannot share with you the details or the topic of my PhD project. So basically, just this is a general explanation, introduction for what am I doing here. So I am working with specific scavenger receptor, and I'm basically investigating the mechanism, the role of it in the atherosclerosis. But even though I cannot share with you the details or result of my PhD project, I wanted to show you at least what kind of methodology I am using in my PhD. So basically, we have 3 different approaches. So we are basically investigating on human levels, on mice levels, in vivo levels, and in vitro levels. On human levels, basically what we are doing is patients going through carotid endarterectomy. So basically, when you have the atherosclerotic plaque in your carotid artery, these are basically isolated surgically, and this plaque is analyzed for association between the target gene expression and the markers of plaque vulnerability, or target gene expression and association between symptomatic versus asymptomatic plaque. In mouse level, what we do. So basically, my PhD project heavily focused on, based on mice experiments. So basically, when you have your target and you want to answer the question, okay, what this gene is specifically doing, right? So basically what you want to do is delete this gene in the mice. So you have basically global knockout mice. So you have wild type mice, which is kind of normal mice, and then you delete the gene and you generate this gene specific knockout. And you induce atherosclerosis by feeding them with high fat diet, for instance. And then after several time, like let's say 4 weeks or 12 weeks, depends on the level of atherosclerosis, you isolate. In our case, we isolate the heart, we isolate the aortic arch with 3 different branches. What we do is we analyze the phenotype. Okay, what is this gene is doing once we delete it? Is it good or is it bad? Is it getting better? Atherosclerosis may be not developing at all, or is a bit less, which is good for us, right? Okay, once we answer these questions, we need to still answer on molecular levels, on cellular levels, what is happening. So the phenotype is just to have an idea what is going on, right? But so for instance, every scientist's dream is to basically develop a drug. So it will be not only on the bench, but it will develop to the bedside of the patient, right? So you want to answer a specific question, how this receptor works, which proteins or which adaptive proteins it involves to this disease, right? So basically, we are doing lots of in vitro experiments, basically working with cells. So just to have an idea, so in my PhD project, I'm doing old-fashioned classical Western blot, of course, ELISA, qPCR. We are doing flow cytometry. We are visualizing it with different type of microscopies, confocal microscopy, but also we are doing several type of sequencing. So I hope you have general idea at least what am I doing currently in my PhD project. But I wanted to tell you that it's not only about the lab research. So during your PhD, I thought actually that this meme would be self-explanatory because this is so true. It hurts actually. So basically, you need to really balance. And when you are doing a PhD, you need to remember that it's not a sprint, right? It's a marathon. In Germany, at least, it takes 4 to 5 years. So it's really actually hard. So basically, first thing you need to answer yourself is, why do you need to do PhD? So you need to be honest with yourself. For instance, if the answer is, well, because I'm just scrolling my Instagram and it seems like everyone in my feed is doing PhD, so why not? Then it's the wrong answer because it's really, really difficult. So you will always have your ups and downs. It's like a roller coaster. So for instance, during my PhD, I am doing mainly the lab research. It's long working hours, but also during this 4 to 5 years, you need to collect ECTS, so basically the credits to be eligible to graduate eventually. But also conferences are very important. So doesn't matter in which prestigious institute you are working. When you are working with your colleagues and other professors, you are living in your bubble, right? So you need to always leave this bubble, go to international conferences and share, and also learn from other professors and share your results and get their ask their opinions about your project. So during the PhD, it's also important to attend conferences, present your data, present your project, and also do some posters as well. Also during the PhD, we are doing several workshops. So here I mentioned only like soft skills because it's also very important. So PhD is not always about the hard skills, but soft skills are important. Your time management, your presentation skills, or your communication skills also very important because you can imagine that during your PhD, you will be working with scientists from all over the world. So international communication skills are also very important. We are doing also volunteering stuff. For instance, with other PhD students and professors, we are organizing summer schools for high school students who are really genuinely interested in medicine, science, especially neuroscience. So for instance, this year in July, it will be 2 weeks summer school where we will explain them theoretically, but also show them the experiments, how to do, and every student will have their own small project. So I'm actually looking forward to it. But also I am a graduate school student representative. So basically for the last 2 years, I think. So we are also organizing some extracurricular activities or organizing the retreat for students. Well, mentioning this, I want to again emphasize how well-being is important. So of course you will be spending all your time for your PhD project, but you need to really take care of your physical but also mental health. So for me personally, hobbies really help. So I really like diving into music, and thankfully I'm really grateful for this. Munich offers lots of cultural events for this. So I do music, so play piano and dobra, and attend to several exhibitions, and yeah, some sports like Pilates and hiking is also really refreshing, I would say. All right, here I just wanted to show you. Okay, so I am a PhD candidate at LMU, Ludwig Maximilian University of Munich, but actually, even though I'm enrolled in the university, I'm working at LMU Clinicum. So this is the university hospital of LMU. And I just wanted to share with you the latest rating of World's Best Hospital 2024. And LMU Clinicum is actually in top 30, which I actually I'm really proud of. Here, I just wanted to show you the World's Best Hospital 2024 Germany, and here comes the courtesy towards Galymzhan, that Charité actually starting this beautiful rating. And actually, I checked the Charité rating in World's Best Hospitals, and it's actually, if I'm not mistaken, 6. So I'm really happy for you. Not so much, but I'm okay. Congratulations.
Before coming to Germany, I don't know about that.
Oh, really?
And only later I learned that
famous.
Charité is a great hospital.
Oh, no, it's
Yeah,
really,
yeah.
but actually I was surprised, but that it's actually 6, because I mean, of course, first usually it's a US hospital. So the first is Mayo, and then I think Cleveland Hospital, but Charité, yeah, 6. All right. So here I just wanted to share some list. So, all right, I'm working there, but how to get this position right? So as Islam mentioned, in Europe, there are lots of scholarships available. And here I just wanted to share with you that my PhD project, I found through findaphd.com website. So it's really, really helpful. So if you are not familiar with it, I would really recommend to check this out. So through this website, you can actually filter countries, funding, fields and topics, if I'm not mistaken, but also so you can find the available positions, but also if you are doing currently PhD, there are lots of helpful sources, advice, etc. All right, so I found my position here in findaphd.com, and I have applied, and I went through several interview sessions, right? But actually my project is funded by DFG. So it's a Deutsche Forschungsgemeinschaft. So it's German Ministry of Education, basically. So basically when you have a hypothesis, when you have an idea, you write the grant, right? You write the grant, you apply it, and you hope for the best. And yeah, so we won this grant, and my project currently is funded by DFG for next 3 years. And I'm getting actually my salary by DFG. So you need to know that in Germany, you are getting salary. So you are not considered as a student, right? It's a bit different. It's differs from country to country. So first idea was, after my master in Bristol, I wanted to continue to pursue my PhD in England. In England, it's a bit different. So in England, you need to pay a huge amount of tuition fee. So you are still considered as a student. You can also apply for several scholarships. They are partially covering the tuition fee. So they are only covering on home rate, local rate, basically, and you need to pay the difference. So you need to know these details beforehand. So basically, here you are paid fully, and then you are basically also secured socially. Also, the employee is covering your health insurance, and you are even getting some pension. Besides that, so let's say you didn't find interesting project in Find PhD or in any other available sources. There are lots of funding sources. For instance, I just put here DART, which is really famous German exchange program, which is also covering doctoral programs, but also famous Max Planck Association and also Helmholtz. So basically it's like this. Let's say you opened immediately now Find a PhD, you basically quickly scanned the available positions. You didn't find very interesting position. What I really recommend you, so let's say you are cardiologist, right? And you are really interested in, I don't know, arrhythmia, right? And basically you create your own list with professors who are really working in this field. And I would recommend you to write to them, email with your attached CV, and basically ask if they have positions open, or maybe could be that they currently don't have, but they are in the process of applying for DFG grant, and they are basically waiting for a reply. Could be. So basically, you need to be a bit proactive and send several emails. All right. All right, so as you can imagine, I'm heavily advertising Munich. And if you were not, I don't know, inspired still, I'm taking out my last card. It's Neuschwanstein Castle, which is really, really beautiful. And it's just 1 hour away from Munich. So I hope you will get your position. And yeah, welcome to München. Thank you very much.
Thank you so much, Arailym. Thank you so much for sharing your research and also briefly touch on every aspect of getting the scholarships and how to survive PhD studies. And I am thrilled to announce that we are starting our Q&A session. Thank you everyone for sticking with us, writing your questions in the chat. And I'm gonna first start with a general question to all of our speakers. Khairat was wondering, what would you advise current students in Kazakhstan? This is the question addressed for anyone. Yeah, please.
It's difficult sometimes to give a piece of advice which would fit everybody, because different people, different careers. But definitely one piece of advice I give to every and each medical student: learn English. Today, a doctor, a physician, a scientist without English, it's not a doctor or a researcher. It's inevitable. Learn English. I would say this piece of advice fits each and every career. English is the future. In this language, the knowledge is generated, research is generated. This is the very first piece of advice I would give. The second is probably, as I mentioned, think about your career. Sit, take a pen and a paper and think of you as a third person, how you would like to develop your career. What is the next, maybe educational step? Maybe that would be some interesting research. Maybe that would be master's degree or PhD in Kazakhstan or outside. Where would you like to go in your career? Think strategically, in complete silence, only with yourself. This is it. And if you really would like to study or work here in Europe, don't wait for something. You don't need to be great to start, but you need to start to be great. Start today. Maybe you would like to write an email to a certain professor. Maybe you are interested in some program. Maybe you would want to apply for a job here. There are people from Kazakhstan who directly had access to the labor market here in Switzerland, and they were lucky enough to be supported. There are people who have written to professors in US or in Europe, and they were supported. The professor was very supportive. He said, oh, exactly, I have the money for you. I have the money, I have no open position. That was on top of my mind. I forgot about it. Okay, you have a Zoom meeting, 40 minutes, and you get accepted in US. It's a luck, definitely. So be proactive. This is it.
Thank you so much for sharing. I would like to ask a question for Galymzhan. Several people are wondering what is your plan after PhD, and if we have time, I would also like to ask Arailym and Islam, where do you see yourself in 5 years? So after you've done your PhD, or what's your career path in 5 years?
Aliya, thank you for your question. Before going to this question, I want to go back to questions that you asked to Islam, and maybe Arailym also have some insights to share about the question. So my follow-up to Islam's recommendation is, okay, you learn English, prepare for USMLE. Even if you're not taking this exam, United States medical license examination, it will help you, if we say broadly, you will kill less patients when you go to hospital as a doctor. Like maybe I'm using like a little bit rude example, but like the way of thinking, clinical decision-making process is trained during preparation to this exam. Let's say without USMLE, like let's say SAU and future doctor, maybe within your career because of doctor error, mistake, you will kill 5 patients. But if you take this exam and prepare properly, understand how exams working, you will kill, let's say, 1 patient. So this, my recommendation is really, even if at the beginning, if you don't understand the question, clinical question, what they're asking, it's a good way for training. And after that, you will have really good clinical decision-making practice before going to your clinic. This is my first recommendation, because personally, for me, it helped a lot. And second question is just be, it's not important going to abroad and trying to, it's great to have this experience working in, trying to get work in US or Germany, Switzerland, and other countries. But it's also, you have great opportunity to take your niche in Kazakhstan or wherever you're located. I think it's also great because for me personally, I'm forwarding to next question, what I'm planning to do after my PhD. I think it's also very good to go back to this country as another plan, establish your small group, well, collaborate with researcher, and do your niche there, because here it's already, let's say, saturated, not oversaturated, but field is kind of all people already did all things. But in these countries, let's say, for example, deep brain stimulation within the world, it's very known technique, 30 years, everyone is doing. But in Kazakhstan or Central Asia, only 2 centers are doing this. And I know the people who are doing that and or trying also to contribute to them. And it's very important, learn technique, come to your country, try to stand on your stand on your foot independently, and do your work, because we have a lot of opportunities there. So it's not often important looking back to other countries. Okay, try, because you will spend a lot of energy, a lot of time, and success is not guaranteed. Just 2 advice. Maybe Arailym have something else to add, yeah, to medical students.
Yeah, so basically, I agree with all the points. You need to be really proactive, and you need to, I think also another point is networking. So it's always important to talk with people, to try to find out those who are already did this and ask for their advice. Also try to, like, already that you are here in this panel discussion is already a very great step towards your goal. So you need to be just basically proactive, scan the opportunities, constantly check, make a list, and basically follow the steps. Yeah, and yeah, you just need to try it out. Otherwise, you will never know.
Thank you so much. And would you like to share where do you see yourself in 5 years, or
so I can start.
Yep.
So now, as I mentioned, I'm working in clinical research at the University Hospital, and I have 3-year contract till almost 2027. So I'm not sure if I would leave the hospital before. I have chosen Switzerland because it has wide opportunities, many opportunities in clinical research just after the US, but it's closer to Kazakhstan. And I think, so I would probably stay here during the next 5 years, probably either working at the hospital as a clinical researcher, so developing my career here, or there are also opportunities in big pharma. You have probably heard Roche, Hoffmann La Roche, Novartis, Lonza, very, large big pharma companies headquartered here in Basel. So Basel, in this sense, is kind of mecca of clinical research, and that's why I'm here. So probably will develop my career during the next 5 years here.
Thank you. How about you, Arailym?
Well, first thing first, I need to graduate from my PhD, which I'm hopefully planning to do it next year, end of next year. So in terms of long-term plans, I think I need to I'm planning at least to find a position where I can combine my both clinical but also scientific background, which I think for me it's very important, because when I walked in emergency medicine department, was very interesting. I was always craving to start from emergency medicine, and I really liked this adrenaline and then differential diagnosis where you have a bunch of symptoms and you need to find out what is going on in a very short term, right? But I didn't actually utilize all the knowledge I got from my master, right? So having my PhD, which is heavily based on wet lab experiments, and having my MD, I think it will be ideal to do some drug developments or diagnostics. So I am considering, I think, industry.
Thank you so much.
Working as a clinical scientist in academia. Well, let's see.
Yeah, it's a long journey until you graduate PhD studies. We have a question for Galymzhan. Do you see yourself more in clinical research or in aerospace medicine? Do you have any preference right now?
Yeah. So for now, so my personal experience after talking with these physicians of astronauts and cosmonauts was I recommend to be tightly connected with your field specialty. It's wherever it's emergency medicine or neurology and other thing, and also try to contribute to this field of aerospace medicine. So my future perspective in Germany and Cologne, we have aerospace center. Maybe some of you heard about this. It's mainly taking European astronauts after a space flight mission for recovery, and they also doing a lot of researches which related to post-flight studies. So I'm pretty much looking forward to do some network with them, and in the future also look for career opportunities there, and also looking for opportunities in Kazakhstan because now I also have a connection, doing this connection, trying to help physicians in the field of neurology, neurosurgery. Because when I stayed in Japan, I also invited several physicians there to come and train. So I'm also looking forward for different types, mainly in academical hospital. And second is related to aerospace medicine.
Thank you. We have a question for Islam. Ayana is wondering, is it possible to become a researcher without undergoing residency? We also have some questions about the prerequisites, like having publications, what kind of publications, what kind of journals. Please address.
So you see, guys, there are often this confusion about medical practice, working as a physician, and research. You don't need residency at all. I didn't do my residency in Kazakhstan. I went from the Medical University Astana directly to Master's in Public Health, Nazarbayev University, and PhD in Public Health here in Basel. The only prerequisite was to have master's degree. Or if you have MD, if you're a physician, you also might be considered for a PhD as a PhD candidate to do PhD here. So having MD is also a prerequisite. You don't need residency if you want to do research. These are completely parallel worlds, I would say. If you want to go to clinical research, to do science, focus on master's degree or PhD. If you want to work as a physician, do residency, or if you would not like to do residency in Kazakhstan, you can apply for a job, you can register your diploma in Germany or in Switzerland and start working as a physician. Here, residency is a bit different. The concept of residency is different. You are basically working as a physician during all, let's say, 5 years, you get the salary, and you are a physician. You're physician assistant, врач assistant, not assistant врача. These are different things. And you get the salary, you're building your career, developing your career. Yeah, that's it. So completely different things. You don't need MD to do research. You don't need PhD to work as a doctor. You see, they are in parallel.
Thank you so
And
much.
by the way, one second.
Mhm.
About the prerequisite, about the publication, I had one publication before my PhD, but it is just a plus. It's not a prerequisite at all, because you are trained during PhD to publish papers, basically. During PhD, yes, there is a requirement to graduate from PhD to have at least 3 publications. At least it's like that at the University of Basel. But for a PhD, you might have, it's a good option. You might have a competitive advantage if you have a publication, but it's not a prerequisite.
Thank you. Do you have any other suggestions, Arailym or Galymzhan, about the topic of prerequisites? Like publications or any other experience?
So having publication is always a plus, but it's not necessarily. It will be advantages. So it will show the PIs that you know the concept, you know how to write, and basically it is not important that you are publishing in Q1 or Q2. It will just show them that you are familiar with the concept of writing, but it's just helping you. But as Islam mentioned, it is not necessary. I would rather say one more advice when you are looking for a PhD positions. I think because there was some question about how did you choose the PhD positions, basically. So first of all, you need to be really in love with your topic. Otherwise, I think it's really bad if you are not in love and you don't have this chemistry. So you need to be, first of all, in love. You need to really like your project. Second of all, environment is important. So you need to know yourself, and you need to be like, you need to sit and be really honest. What's your style? Do you like working long hours? If you are looking for ambition, if you want to publish in very high impact journals like Nature, Science, Cell, which is like in our field, they are very high impact factor journals, then you need to basically quickly scan the PI's publications, right? Where this actually lab is publishing their papers. If this is high impact journals, it means that the requirement in that team will be very high. You need to expect that working hours will be long. So if this is not okay for you, which is totally fine, we are different, right? Then you need to be a bit careful when you are choosing the positions. So it could be that the topic is very beautiful, but could be that they are publishing in very low impact journals, which is not okay with you. You need to publish in Nature, Science, and you want to do this very qualitative, I would say. I don't know, I don't want to offend anyone, but you know what I mean, right? So you need to, first of all, be in love. Second of all, check the environment, PI. Also, the relationship between student and PI, principal investigator, is very, very important. So 2 things, personality and also supervision style. You could end up with a very nice, very supportive, very, I would say, good person as a PI, but this PI could basically rarely come to the lab, and you could lack this technicalities, the supervision. It could be other way around, unfortunately, that this PI is very supportive, but very demanding in a very toxic way. This could be as well. So before signing anything, you need to do a proper research. You need to ask other lab members, which is totally fine. When you are having actually interview sessions, first you'll always have this kind of introduction where you are, I don't know, presenting your master dissertation to the PI, etc. And then you have second round, third round, right? But you are allowed to have an interview with other lab members, to ask the situation, the vibe, what is going on in this lab. You can ask other lab members, okay, what's the style of working? What's our working hours, etc. So you are allowed to, and I really encourage you to do this. What else? If I'm not, and then of course funding. Yeah, you need to.
Thank you.
Yeah,
Very extensive answer.
I want to add to Arailym, amazing recommendations. Thank you. And last one, Arailym said, first one, you need to be in love in your topic, and you need to somehow professionally show it. So when you're contacting to your supervisor, future supervisor, or approaching in a conference, you need to professionally, not too much, not too show. Yeah. So, and you need to be appropriately professionally, because often we did not receive these like teaching methods of how to be professional. Okay, you did your medical school, but how to speak with people, what's the best moment to speak? I think this moment is very important. If you really show that you're really in passion with this topic, that you're even ready to spend your last money to travel from Kazakhstan to Europe, so this professor's university, he will take you. Yeah, so I think this is very important, like I couldn't add more to Arailym's recommendation, amazing recommendations. So thank you.
Thank you so much. Touching on the topic of being in love with the research topic, how do you know that you love the topic before you start your PhD? So several people are wondering, how did you choose your topic? This question was addressed to Arailym and Islam, actually.
Can I start here?
Yeah.
The organization that I mentioned, Swiss School of Public Health, which basically announced these 50 PhD fellowships, they explicitly mentioned that 10 of these scholarships would go to candidates which would present research proposals with some public health issues or research on public health issues which are actual in their country of residence. So I was thinking about which issues and problems do we have in our medical systems? There are billions of problems, right? You need to choose one. And during my MD years as a student and during my master's degree, I was doing research completely on other stuff. And it was always somewhere on the top of my mind, on the background, palliative care. Okay, we have healthcare mostly directed to prolonging life. There is surgery, antibiotics, cardiology, neurosurgery, etc., etc., etc. Prolonging life. But there are some cases, patients with terminal diseases whose life cannot be prolonged. It's terminal disease. It might be cardiovascular disease, right? Like heart failure. So it might be cancer, terminal cancer, which cannot be treated anymore with radiology or chemotherapy or surgery. And there is an option for them, palliative care, quality improvement of quality of life, life support, psychological support, physical support, etc., which is very under-investigated and underdeveloped, not only in Kazakhstan, but I would say worldwide. And that's always was on top of my mind. I don't know why, maybe because we had lack of courses on it, or maybe because during my time during oncology course, we have seen these patients and that affected me, right? Maybe, but it was always somewhere there in my brain. And I was thinking, okay, actual problem, palliative care. That was the first and very option. I didn't have any other options. And I contacted my ex-supervisor at that time. I already graduated from the master's degree at the Nazarbayev University, and my ex-supervisor was Byron Lawrence Crape. He is the director of master's program at Nazarbayev University School of Medicine. He supported the idea. He was very supportive and enthusiastic. We have prepared the research proposal. It took us several months, 12 pages, MS Word file, introduction, planned methods, actuality, implications. That's it. Then I found the support here in Basel, a professor, a supervisor, and three of us, we submitted this proposal to the Swiss School of Public Health, because Swiss School of Public Health, they should see not only your research proposal, but your support. They don't give money to your pocket. They give money to the university with the professor who wants to support you, because PhD is a one-to-one work with your supervisor. So this is it. It's all about your experiences. Maybe you need to think about it, to reflect on your, I don't know, studies or working experience. In Kazakhstan, there are thousands of potentially uninvestigated topics, believe me. So this is how you do it. There is no, I would say, nobody would come to you and give you a topic. Take this topic and apply. Just think about it. If you can explain the actuality, then you can apply.
Thank you. How about Arailym?
Yeah, I just wanted to add that there are two approaches. First is coming to the PI, to the supervisor with your own idea, with your research proposal. Also, there is a way to apply already to the available positions, which I actually did. So it was very general, of course, because they cannot share the details in a position, but it was related to my field. Because as I mentioned, I did my master in atherosclerosis. I wanted to continue in atherosclerosis, and I actually found the position which is advertising a position, and they are going to work in atherosclerosis. And then I applied, and during the interview, they shared the details, right? So you will always have two approaches: coming up with your own idea, and second, to apply to already available grants. Because as I mentioned, in Germany, PIs are constantly writing grants, right? And they are writing a project. And if they are having a fund, then they start advertising this position for PhD students that, hey, we have already funding for this specific project, and we want student who is going to work in this project. So it's two ways to do this.
Thank you so much. Before we finalize our Q&A session, I would like to ask our speakers to write contacts in the chat, because we do have lots of specific questions regarding the application process and so on. And while you're writing in the chat your contacts, it could be Instagram, LinkedIn, or any other social media contact. I would like to ask one more question. It's the final question due to the time limit, which is about the funding. So would you know right now how to choose your PhD or postdoc position, how to choose the topic, how to do PhD or postdoc, how to develop your career, but we haven't touched on the financial aspect. So there is a question to Islam. What was the salary during your PhD enough to live in Switzerland?
Usually people don't talk about their salary, but not me. So during my PhD, as I mentioned again, these 10 PhDs, which were PhD fellowships, there were 42 Europeans and 10 to poor guys from third countries. And believe me, our salary in the same universities in the same PhD program was almost twice less than salaries of the Europeans. Why? There is no issues with racism or something. No, it's because our research was partially conducted in Kazakhstan. Therefore, according to my contract, I spent in Kazakhstan 1 year during my PhD. You see, and of course, Kazakhstan is a cheaper country, therefore you get less salary. And my salary was for all the 3 years, 100,000 euro, I would say euro, which is 2,500 a month. which is just 200 euros more than the minimal income in the country. With the minimal income, I think it's 2,300, and I got 2,500 during 36, it's actually 42 months as a PhD student. So for Switzerland, it's, of course, it's, I mean, for Swiss people, it's less than nothing. But I could afford almost anything. I rent a room in the apartment, and I lived alone there. Very nice house, private house. Food and clothing was not a problem at all. I spared some money. I had money to travel to Kazakhstan. I mean, we are from Kazakhstan, okay? We are not used to luxury life. So that's why 2,500 was okay at that time. But then you move on after graduation, because my first, I mean, guys, your objective is not to earn money during your PhD, okay? Definitely Switzerland wouldn't give you in. I mean, they would give you money to live good life, just decent life, not good, decent life. But after you obtain your diploma, you basically, then you earn more, of course. But 2,500, I mean, it's 2 times more than in Germany, and it's more than in US. In US, they get about 2,000. In Germany, 1,500, as far as I know. I don't know. But here, 2,500, but cost of life, cost of living, of course, is higher. But pretty sure, guys, you would be okay. And it was my PhD fellowship. I don't think that your salary would be less. I mean, if you get the PhD here, it's not salary, it's stipend. Usually stipend here on average is about 5,000. You see, 5,000 is more than enough.
Thank you so much. Do we have any other suggestions from Arailym or Galymzhan? If not, we're gonna finalize our meeting.
And can we ask this question and last question? So the audience had the main question is, what's the challenges and rewards of pursuing this clinician-scientist career path? So you guys like previously did a medical degree and now doing your research, PhD, postdoc. And what do you think, like for our audience, mainly medical students, residents, why it's important to do clinical research and to be clinician scientist? What you can gain from that? What do you think, guys?
Arailym, you can start, I think.
Sure. For me personally, so my insight is I understand that all audience are going through or did already MD, went through medical university. So you guys are not afraid of any working hours, long hours. We are all stress resistant, I would say. This is not a problem. For me personally, since we all have clinical background, currently I am surrounded by world-class biochemists, like who are working in biochemistry, biologists. So they are really deep into theoretical knowledge. And I feel that I'm constantly lacking the details, right? The deep knowledge. So I have clinical mindset and I cannot change that. I'm constantly thinking, okay, how can I introduce this to patients, etc. For biologists, it works a bit different. So when I go home, I constantly need to do lots of background reading about biochemistry, about biology. This could be a bit challenging, but also if you are a curious person, I think it's inspiring, I would say.
Great.
Can I continue?
Yeah, Islam, sure.
The minimal salary of a clinical scientist in Switzerland is 100,000. As a postdoc, you earn on average 100,000. As a experienced clinical scientist with PhD, MD, working in big pharma, it doubles, triples. Work-life balance. You don't have night shifts. You don't work directly with patients. You earn just like any other doctor. You are mobile. You can work in one company or the other. you might be easier to be replaced than a surgeon, I would say. But definitely clinical research, clinical science is, I would say, somewhat new discipline, which is gaining more and more attention and popularity worldwide. In Kazakhstan, it's not yet widely known. Even here, it's gaining more and more attention. But it's definitely the future. The world population aging is speeding up, and there are more and more bigger and bigger need in new drugs, new developments, and research. So it's completely based on your personal preferences. I'm not advertising clinical research. Sometimes you think, oh no, I can't give up working with patients. No go for me. Even today, after all the years of my PhD and now working in the hospital, nobody in Kazakhstan understands what I'm doing. People think I'm treating patients. I'm not treating patients. I'm doing some procedure with participants of the study, but I'm not doing any surgery. And people in Kazakhstan don't understand, what do you do in the cardiac surgery department if you are not a cardiac surgeon? So, you know, there is a very simplified understanding of career, I would say. Here, there are many opportunities. This is it.
I just wanted to add something on top of it.
Yeah.
So, yeah, we know that every day there are lots of publications, right? About I'm talking about my field, about, I don't know, mechanisms in atherosclerosis. And this is mostly written by biologists. And these papers are rarely read by clinicians who are working directly with patients who are suffering from atherosclerosis, right? And I feel that clinical scientists are like a bridge between hospital and actual lab, working as a bridge, because clinical scientists, they have both clinical understanding, but also they know what this Western blot means, right? Right. You can read the graphs. So you can make this science translational. You can actually deliver the last, I don't know, a very beautiful data to the bedside. And this is a kind of a connection point between hospital and the lab. And I think it's very beautiful and important.
Yeah, great insight, Arailym, Islam. Thank you. And last one, I have same feeling like one of the professors that I met in conference. He said, I think his talk was amazing. Like, okay, we're doing this science every day, reading the papers, and sometimes really amazed with some papers. But we trained physicians, we doctors, and every day seeing the patient and human being is being human being. One of the factors is having compassion, sostradание. So we are good. We have our health really good, but some people's when you see, and somehow you want to influence that. So there's a 3 scales how you can influence. As a doctor, you can influence people one by one. If you want to be doctor, you can go this way without doing research. But if you're doing some research, clinical research, you can affect on a big scale. If you're doing really good quality research, and if you want to even more affect more, you can go to industry, like medical companies like Medtronic or others, and they're really affecting huge amount of population. So I think other factors is also important, like this life cost and family and other factors. But I think this point is what makes us human is compassion, sostradание. And if we have the compassion, we will do to help other people, because we are doctors. We have this, we have this education. Yeah. So, yeah, I'm always all these things. Yeah, and fine. So,
Thank you so much for our speakers. I would like to thank everyone today who stayed with us for 2 hours to learn about the clinical research, the challenges, the rewards, and who asked the questions. I hope that you learned something useful today. If you have any further questions, please don't hesitate to reach out to us by the Gmails that I've shared in the chat. And I'm happy to see you again in our next meetings.
Thank you very much, guys. Bye, everyone.
Thank you very much for organizing this. Bye.
Bye, guys.
Thank you. Thank you for joining. Thank you everyone for joining.